Hello everybody and welcome back to my channel. There are several different causes of a red eye. Today I will be talking about one of the more subtle causes of a red eye, which is called episcleritis. This condition can actually be asymptomatic, meaning patients have no symptoms, but they do have the presence of the redness, which is very indicative of episcleritis. If you would like to learn more about this condition, then please stay tuned. So guys, let's jump straight into the video. Episcleritis is a condition that tends to be fairly benign, meaning it usually has no underlying systemic associations or causes, and it also usually is self-limiting, meaning it will get better on its own. There are a couple of different types of episcleritis. There's the simple type of episcleritis, and then there's the nodular type of episcleritis. The nodular type can cause the sensation of a foreign body sensation, and both of the types of episcleritis, including nodular and simple episcleritis, can cause watering, discomfort, and also sensitivity to lights. It is important when faced with a patient with episcleritis to carefully and accurately take a good history and perform a thorough systemic review, because sometimes these patients can have underlying connective tissue disorders, so it's important to essentially screen from top to toe and consider each system in turn, and consider and entertain the possibility of a potential underlying systemic cause for the episcleritis. This can be also helpful in trying to differentiate episcleritis from scleritis, which is a slightly more inverted commas sinister pathology. As mentioned, episcleritis tends to be self-limited, but some patients may find therapeutic benefit from using cold compressors, using topical lubricants, and using oral analgesia. The very important and rather neat clinical test that can help to differentiate episcleritis from scleritis is using phenylephrine 10%, which will blanch the redness of episcleritis but will not do so in the case of scleritis. If you would like to learn more about the various different causes for red eyes, then I would encourage you to watch my video about red eyes, which I have shown up here, and I will link down in the description below. Thank you so much for watching this short video about episcleritis. I hope you have found the information useful, digestible in the bite-sized chunks that I have provided the information in, and hopefully you can use the information to either benefit yourself or others. Please do click the like button, the subscribe button, and do comment below. I look forward to seeing you on the next video. Thank you.